Hello and welcome to Intimate Lens. Today's Zoom is on organ prolapse and intercourse. Very common scenario out there, and women have many questions. Let's answer as much as we can. Whether you were diagnosed with bladder prolapse or uterine prolapse or rectal anal prolapse, the three typical drooping of organs in the urogenital system of a female, there are several concerns that women do bring up on a regular basis. First off, they're upset about the diagnosis, and we certainly understand that. Who wants their body part to get out of place and be hanging lower than they should? Secondly, it may interfere with functions. If you have a bladder prolapse, you may not have any symptoms, but if you do, and bladder prolapse is also known as a cyctocele, if you do, you may have either urinary incontinence or urinary retention. You may have difficulty voiding. You may feel some pressure. Those of you who have that can relate. If you have a uterine prolapse, where the uterus is beginning to droop into the vaginal canal, again, you may not have any symptoms, or you may have symptoms of heaviness. You may even feel the uterus when you wipe at the toilet. You may even, in progressive cases, see the uterus protruding out from between your lips in a visible way. If you have a rectal prolapse or anal canal prolapse, you may have difficulty voiding. You may sometimes need to even help yourself manually by putting the finger in the vagina and pushing into the rectum so that the fecal matter will be easily moved out of your system. So you're not happy about the diagnosis. We totally understand that. You wish you didn't have to deal with it. We totally understand that. Now you're worried. Will it get worse? What if I would like to get pregnant? Will I be able to? Will it get worse during my pregnancy? What if you really do not care to undergo surgery? Not that it's always the solution to this, not that it is the only solution for it, not that it is the immediate solution for it. Nonetheless, the topic may come up. You may have read about it or heard about it, and you're not too keen on that. So you're worried. Proper medical diagnosis and counseling and guidance is extremely imperative. So please seek that. Speak to your doctor. Don't hesitate, and get all the answers you're looking for. Now, when it comes to the bedroom, or wherever you are sexually active, you're worried. What if? Can I have the penis go into me? What if it will injure the whatever is drooping inside me, the bladder, the uterus, the anal canal? Some women say that it feels too crowded or too stuffy in there with a prolapse present in the vagina. And you're really concerned. Some women find that they will void some urine during the act, and they're embarrassed and concerned about that. And it's very easy, as we have mentioned and explained in other videos on this channel, for the woman to totally shut down sexually, or to totally say, I think about being intimate, but forget it. There's no way I'm going. I'm too consumed with all these worries and discomforts and embarrassments. And what will my partner think, and how will the partner feel about it, etc., etc. So again, where do you go from here? Unless medically stated to the contrary, you're fine and safe to engage sexually. Choose a position that feels comfortable to you. A position where you don't feel too stuffy in there, a position you don't feel irritated, a position you don't feel you're leaking urine as much, or any other consideration you may have. And some women don't have any consideration. and they are just fine despite the prolapse. For example, a position that would be most advantageous for prolapses would be all fours or doggy style. Give it a shot, see if it works for you. Another position you may try is side by side or spooning. See if that works for you. Woman on top seems to be just like standing up, gravity pulling down. May not be your ideal position unless you prolapse or prolapses, if you have more than one organ prolapsing, unless the prolapse is not disruptive. So experiment. It's not dangerous unless you were told absolutely do not have anything in the vagina. We need to immediately attend to it because of XYZ. Otherwise, you're safe, you're fine, engage. Absolutely do not shut down. Do not let the fears come in. Choose a position that's comfortable. If you leak some urine, oh well, that's okay. The partner will be okay with that. They seem to be okay with that. It's usually the woman who suffers who is most embarrassed. It is extremely essential also, and many of our videos discuss that, the body-mind connection. The worry right away will shut them down sexually or will lead to painful sexual engagement. Please mind it. Please remember it's the same you with or without the prolapse. Please remember you didn't ask for it to happen. Please remember to speak to your doctor, get proper counseling and proper guidance so you could be totally alive, totally engaging, totally doing all right with that little glitch called a prolapse. Take care of yourself, my friend. Don't let it take you down. Please share, like, subscribe to our channel. Let us know if you have any questions, and we'll see you next time.